The days of strapping a loud, uncomfortable mask to your face just to survive the night are officially coming to an end. Science has finally figured out how to treat sleep apnea without turning your bed into a hospital ward. And the new methods are straight out of a sci-fi movie. For decades, if you had obstructive sleep apnea, you were basically handed a CPAP machine and told, "Good luck." Sleep apnea happens when the muscles in your throat relax too much during sleep, causing your airway to collapse. You stop breathing, your oxygen levels tank, and your brain goes into panic mode to wake you up just enough to gasp for air. This happens dozens of times an hour, ruining your sleep, destroying your focus, and putting massive stress on your heart. The CPAP machine fixes this by forcing pressurized air down your throat to keep the airway open. It is highly effective, but the reality is that most people absolutely hate it. You have to sleep with a bulky mask strapped to your head, dealing with air leaks, dry mouth, and a machine that sounds like a vacuum cleaner. A huge percentage of people just give up and stop using it. Other old-school options include wearing a massive mouthguard that forces your jaw forward, or going through brutal surgeries where doctors literally cut out parts of your throat or break and reposition your jaw bones. Thankfully, the medical world is finally ditching the one-size-fits-all approach and moving toward precision medicine. The most futuristic upgrade is hypoglossal nerve stimulation. This is essentially a pacemaker for your tongue. Doctors implant a tiny device under your skin, and when you are ready for bed, you just turn it on with a remote control. Every time you take a breath, the device sends a tiny, painless electrical zap to the nerve that controls your tongue. This forces your tongue to move forward and stiffen up, keeping your airway completely open. There are no masks, no hoses, and no noise. Newer versions of this tech are even getting rid of the chest implant entirely, using a tiny battery-free chip and a small patch you just stick under your chin at night. Then there is the massive shift happening thanks to the new wave of weight loss drugs. Medications like tirzepatide and semaglutide are completely changing the game for sleep apnea. A major reason people develop this condition is because excess fat deposits around the neck and throat physically crush the airway when lying down. These drugs are melting that specific fat away so effectively that the FDA recently approved tirzepatide as an official treatment for sleep apnea. Patients are dropping nearly 20% of their body weight, and as the fat disappears, their airway naturally stays open. Instead of just treating the symptom with a machine, this approach is actually eliminating the root physical cause of the obstruction. For those who are not overweight and have zero interest in surgical implants, researchers are developing something even more convenient. We are talking about a literal pill for sleep apnea. Right now, a drug combination known as AD109 is in the works, and it targets the exact neurological glitch that causes the airway to collapse. In a lot of people, the brain simply stops sending the signal to keep the throat muscles tight during sleep, so everything goes limp. This new pill works by targeting your central nervous system to keep those specific upper airway muscles active and toned while the rest of your body is completely asleep. You just swallow a pill before bed, and your throat holds its shape all night long. The medical community is finally realizing that sleep apnea is a complex issue with different causes for different people. Treating everyone with the exact same bulky air pump is an outdated concept. Whether it is a remote-controlled tongue pacemaker, a fat-melting injection, or a muscle-toning pill, the future of sleep is highly personalized and completely mask-free. We are entering an era where fixing your breathing will not require sacrificing your comfort, meaning you can finally get a full night of deep sleep without looking and sounding like Darth Vader. Thank you for watching. If you found this information useful and want to help raise awareness about sleep health, please like this video, share it with someone who needs to hear it, and subscribe to our channel for more clinical health insights.